Hello and welcome everybody. My name's James. I'm the manager of the North Yorkshire Safeguarding Children's Partnership, and I'd like to welcome you to the North Yorkshire Safeguarding Children's Partnership Hidden Harm webinar, which is part of the wider Safeguarding Week for 2021. Safeguarding Week's been brought to you by a variety of different partners involved across children's, adults and the Community Safety Partnership across North Yorkshire, York and the East Riding. So welcome to everyone from those three locality areas. Just to take you through some housekeeping, obviously the event starts at 11, we'll finish at 1 o'clock and we will take a 5-minute leg stretch after our second speaker today. Please ensure cameras and mics are muted as this session is recorded and will be made available to you at the end of the week into next week. And what we'd like you to do is take a moment to share and disseminate the information that you've learned today and from the other events that you've learned across the week, and make sure that that is passed on to colleagues who haven't been able to join us. We'd love to hear your comments, questions and any observations that you might have throughout the session. So please feel free to put these in into the chat and we'll pick periods of time across the session this morning to ask those questions or to review any comments that you might have. As I say, I will send an email with the slides and the recording out at a later date. At the end of the session, I'll circulate a feedback survey and we'd really like you to complete this just to let us know how you found the session, how you found access and information to any of the other webinars as well. So without further ado, what I will do is we'll start with the Hidden Harms webinar. So we've got 4 elements really to focus on today. The Hidden Harm campaign, which is going to be an overview of the work that we've been doing during the pandemic. We'll be looking at family finding. So we've got our colleague Joe, who's come from Children's Social Care, who will be providing an overview to the work that they are doing within that service area. We've also got a focus on social, emotional, mental health. We've got colleagues from HDFT and Harrogate District Foundation Trust and the Clinical Commissioning Group for North Yorkshire. And also we were joined by our designated nurse who will be looking at preventing sudden and unexpected death in infancy. So all these elements that we've been discussing during the pandemic, professionals in all organisations have had to sort of adapt and change to practice to ensure sort of the best services are offered to children, young people and families in the safest possible way during COVID. On behalf of the partnership, what I'd like to do is just express a big thanks to each and everyone and all the members of staff who aren't here today for the continued sort of sterling job that everyone's been doing. And we've faced many challenges, but have adapted and overcome, which is really, really positive. So we talk about hidden harm, and that's the title of today's webinar. And I just wanted to kind of touch on what does hidden harm actually mean? Is it a familiar sort of topic or saying within your organisation? So as you can see from the slide, social isolation and lockdowns have had an increased potential risk on harm for individuals, be it children, young people or their carers, and also for the workforce that we need to be mindful of. This list isn't a sort of a definitive list, so just touching on some of the areas that we've seen. So around mental health, an increase in exploitation, looking at domestic abuse as well, an increase during the pandemic, and also substance misuse. Hidden harm may be hidden given the name, and during the pandemic we've seen a lack of access to normal services in the early days. We've seen some fantastic work of services who've gone above and beyond in terms of the services that they've been offering to children and young people. But at the early stages, we were seeing schools were partly closed to the majority of students. So access to teachers, access to nursing, police officers, leisure staff, you name it, anyone who's working with children, young people and families. We need to be mindful and have, I suppose, an eyes and ears open to look out for potential hidden harm that we might not necessarily have come across. So in terms of the work that we're doing, I think it's really important to say that the pandemic has probably provided opportunity for a great deal of families to come together and spend some really quality time getting to know each other a little bit more than maybe what they have done in the past. And in some cases, we've heard where students particularly have had issues with school, those pressures around bullying in school that might have exacerbated some of the causes of some difficulties have been removed because students haven't had that engagement directly with peers. There may be times where there have been families removed from the wider sort of family network, which again has had a positive impact, as much as in some cases not seeing family members may have a negative impact. So I think it's really important just to kind of reflect that each and every one of us probably on this call will have experienced the pandemic in so many different ways. And it's about how we work with the families and listen to the families that we're working with to make sure that we adapt and change our practice to each individual one and not have like one blanket approach to working across all of those areas. So just touching on mental health, we've seen reported in the media locally and nationally the increase in demand for social, emotional, and mental health services. And Young Minds did some research and said that about 83% of young people with mental health need have said that the coronavirus has made their mental health worse. As I say, there will be some examples of young people who have potentially had mental health difficulties that have eased during the pandemic because of the circumstances surrounding them. I won't spend a lot of time on this because I know we've got Lorna and Ashley who are going to be speaking a little bit later about the social, emotional, mental health services on offer in North Yorkshire. But I would like to bring to your attention the hidden harm and suicide ideation pathway that we've been recently working on. So this is a pathway that's been developed in North Yorkshire now probably for about 3 years. You might be familiar with the purple looking document that has got a cross against it. Just to say that document now is obsolete and historic. We've updated the information, and as you can see from the photo on the slide, we now have a web-based guide which provides 5 different areas. One around general information for individuals around self-harm and suicide ideation. We've got an illustrated pathway identifying the services available at the different levels for children and young people. We've got information there specifically for schools. So from a school's point of view, what to look out for, how to access support and services that are available. We've also got a children and young people's section in the pathway that is directly aimed at them to allow them to identify potential services, and also that's kind of geographically based, which I think within North Yorkshire, covering such a vast area, those services differ dependent on the areas that you live, so a clear illustration as to what services are available. So just really to take note of this new pathway. Again, use it, share it with professionals that you're working with, and just a note to say that if you have got that purple one printed out, if you could discard it and make sure that you use the web version to get the most up-to-date information. And as services change and things evolve, we can react and put information live on the website a lot quicker that way. So hopefully it's something that can be used for yourselves. I'd just like to kind of touch on what work has been happening around hidden harm in North Yorkshire. As a partnership, we've relaunched the Hidden Harm campaign. The Hidden Harm campaign has been around since March, since the pandemic started. We have introduced a podcast that's available for anyone to listen to that talks around what hidden harm is, what services are doing, some of the areas we've seen, which we'll come on to later today in terms of an increase in non-accidental injury under ones. We've seen that obviously increase spike in mental health provision. We've developed resources, literature, materials. So we've got some posters, so the eyes and ears posters that you can see on the slides. Again, they're available resources to put into community venues, put in school newsletters, disseminate with parents, carers, children, young people themselves. So there is a dedicated web page. So if you go onto the Safeguarding Children's Partnership, you can access the Hidden Harms website that gives you a vast variety of resources, literature and information that you can freely use within your localities and within your teams. Obviously, this will vary. This is a North Yorkshire hosted event today. Colleagues in the city of York and over in the East Riding will have their own approach to heighten awareness of reporting abuse and neglect, and also supporting children and young people. So this is from a view of North Yorkshire today. One of the other areas we've seen is that increase in exploitation, primarily online exploitation during the pandemic, and also recently we're seeing reports of peer-on-peer aspects of exploitation and abuse. Just really to bring to people's attention the Be Aware knowledge hub that we have developed sort of mid last year that went live. So this is an online knowledge hub, again has a variety of information, resources, literature, videos, signposting to support organisations around all of these 7 areas of vulnerability. So that's child exploitation, both criminal and sexual. We've got contextual safeguarding, so that's looking at wider communities, wider impacts, and how we can show sort of multi-agency working and supporting our MACE, which is the multi-agency child exploitation work that we do here in the county. There's information in there around harmful sexual behaviours, missing from home and care, modern slavery, human trafficking, and that online exploitation. So again, please feel free to share the information that is on there. It is for professionals at the moment, and we in a couple of weeks' time we'll have a member of staff who will be developing part 2 and part 3 of the Be Aware Knowledge Hub, which is directly for children and young people, and a part that's directly for parents and carers as well. So something to look forward to and help us get those important messages out to individuals. And then finally, from me, really, before I hand over, I'd just like to bring to your attention the new Threshold Guide, and many of you may have joined us last week for our launch of the Threshold Guide. We've held 3 launch events. So this is what will replace or has replaced the vulnerability checklist. It outlines the threshold for interventions for children and families, going into early help, into children's social care, and into other support organisations. So it's a one document. We will be sharing an illustrated animation again, which describes from a child's point of view the thresholds and what support and what children are telling us that they want from services. So if you haven't seen that already, please visit the website and you can access the threshold document from our practice guidance page on there. So without further ado, what I'd like to do is hand over to Jo Miles, who's the Principal Social Worker for Children and Family Service, who is going to talk to you today about working with fathers and family finding. So welcome, Jo.
Thank you. Morning, everyone. Hopefully today will be a whistle-stop tour to whet your appetite about family finding rather than a full detailed overview of the practice model. But hopefully it'll give you enough to enthuse you and inspire your interest. So I think James is going to throw the slides through for me one at a time. So to begin with, before I start talking about working with fathers and family finding, I thought it would be really useful to remind you that on the partnership page, we do have a whole heap of useful tools to assist colleagues and to inform family with in relation to our practice model. And also there's a hyperlink to the Family Finding International page, which is ran by Kevin Campbell and Liz Wendell over in America. And also what was fitting for me to highlight for you all today, and that you might want to go and have a read in your own time, is a blog that was wrote by the Director of Children and Young People Service in North Yorkshire, Stuart Carlton, only a couple of weeks ago, and it was regarding who loves this child, which is really at the heart of our practice model about it's a whole practice model about how our hearts, bodies, souls and mind, and how we weave through with families our support to them, if that's in early help, if it's in safeguarding, looked after children, or achieving in life, and that's family finding in a nutshell. So there's a really good blog there to have a read that Stuart wrote for the Associates of Directors of Children's Service, if you're keen. If you could move me on, please. Thank you. So our practice model in a nutshell, for those of you who aren't aware, or those of you who do work with us regularly and often, just as a reminder, our whole practice model is in relation to supporting positive change that continues after we no longer need to be involved with children, young people, their family, community and network, and that allows us to build relationships that flourish. So the strapline is keeping children safe and families together, the right intervention at the right time in the right place. So if we can move on, please, James. So you won't be able to see this in any detail, but this is the practice model in a nutshell. We've got the systemic working practice is our one principle. Our one approach is signs of safety, which is a strength-based approach. And then we have 3 intentional behaviours, and their work to identify and build on family strengths and build on what works, creating the right environment with them, for them, standing in the best place to help them, if that's next to them, in front of them or behind them, so to speak. Work as agents for change with it across the whole of our service. We're building purposeful and respectful relationships, and we're working with the whole family, not just the child but the whole family. We can't bypass the grown-ups if we're going to make lasting difference here. The whole family and network, so building lasting family and community relationships. And then you can see the 4 restorative interventions, and with my big blue arrow down to family finding, which is what the majority of my conversation with you guys this morning is going to be. But you'll also hopefully be aware of restorative solutions, family group conferencing and lifelong links. And then our 6 objectives at the bottom is just about the remits we work within, and they're just building long, stable relationships, improving resilience and reducing dependency, managing and reducing risk, maintaining purposeful relationships at all times, intentionally, working at the least prohibited intervention of the Children's Act, and reducing our population of children in care. Thank you, James. So working with fathers, I found this really difficult to summarise in one slide, but I've given it a bash. So for me, if we're working with fathers, we're working and seeing the family before us, every member of that family and what they bring, their expertise, their gifts, their opportunity to help impact change, and most and always, they will always have the answers. Sometimes the answers won't be that children who are in care return to them, but with them we can hear them and know that we need to listen to what they say to help them get the answers to have a better and best future for the children who we're usually involved with. So family trees is vital when we're working with fathers, or when we're working with a family with a non-resident parent, more to the point, to understand the family scripts. What I mean by that, what the roles, routines and patterns and themes are about belonging in their family, to know that every family is different and that's okay. To embrace difference is brilliant, but to understand that people might not be around the table because of employment or money or cultural expectations, but we must consider all of the above if we're going to be fully inclusive with everybody who's important in family. So domestic violence and support groups, parenting groups, what is society offering? Is it proportionate for the parent or the carer who is the non-resident? If that's a father, is it inclusive of times that a parent might be at work Monday to Friday, 9 to 5. What can we do more of to be inclusive collectively together to make sure that we see everybody who's vital in the family? And in this situation, dads who might well be out at work, but then I don't want to be stereotypical either, because sometimes the absent parent is the mother. Do we hold single or multiple truths about the families and dads who aren't there or mums who aren't there? Who's the most important people to the child, to the adult? What are their actions and behaviours? Who, how, why, and when? All that curiosity to fully understand who we're serving to provide the best outcome for them and theirs in their family. Really good article here I've embedded in this slide from Georgia Phillips from the University of East Anglia regarding fathers in repeated proceedings, that's care proceedings, and her findings. And you might want to go and have a read of that later if it's something that interests you. Also in North Yorkshire, we have an Inspiration for Change programme, which is working with parents who have had a child removed from their care, if in private law, in public law, on a permanent basis. It moves on from the pause programme, which predominantly works with mothers, to the Inspiration for Change programme, who works with any parent. And just a little insert of what their logo looks like, and that's a project that runs till March next year. And if anybody's interested or wants to know how to refer to that part of our service, more than happy to point you in the right direction. So moving on to family finding, or as we call family seeing. And I'm not going to apologise for slowing us all down to have a read of this really brilliant piece of mindful thinking that a colleague put together after being on some family finding training. So this picture represents a tree of life, and in a nutshell, it sums up family finding, and it actually sums up, if I needed support in my family, what I would hope to get, and where I would want the people who are helping me would position themselves. So if I'm just going to read some of this out, because I'm very mindful some of the writing is small, but the family holds the answers. I've mentioned that. Maybe you're searching amongst the branches for what appears in the roots. So support, understanding, empathy, hope. What will happen if nothing changes? So we're being curious. If behaviours could speak, what would they say? Those behaviours that we so often see before us. We repeat what we don't repair. Always having hope. Safety is only temporary without healing. Mind, body, soul. Put down the tools of the old system and pick up new ones. What is the intervention for? Dignity-driven practice. Family seeing. If not now, if we're facilitating services, if not now, when? And if not you, who? Who is going to help right now? And who in their family can help them? Or who in my family can help me? Are we working to catch people at their worst, for example, in unannounced visits, or try to talk to them at their best? You can't heal trauma whilst being actively traumatized. The body remembers what the mind may want to forget. Our biography is our biology. Leaning into uncomfortable conversations. ACEs do not define our destiny, so that's adverse childhood experience. The inspiration of hope. Who loves you? Who might love you? Who could learn to love you? The most powerful therapy is human love, which goes back to the blog that our directors recently wrote. There's no safety without belonging. We all need to belong to people. Reach out to someone who could love and care. So are we positioning ourselves in the best place? Am I standing in the place where I can do the most good to support? Pace the intervention. Is it too fast? Is it slow? Is it just right? So stop, listen, think, and eat cake. So hopefully that in a picture form helps you begin to digest the moral compass of family finding, which is a main part of our practice model. Thank you, James. So Kevin Campbell, Northern American, he's the model author of Family Finding, and he says the biggest challenge to family finding has not been to find the family or the tribe or the community that they belong to or live in. It's the process of changing our practice and systems to add enough chairs around the table to have everybody who needs to be there to help us plan with family and decision make. Yeah. So for me, I often think about listening to family, to hear them, not to dismiss them, and their friends and the community. How many people can we now get in a room, clearly COVID safe and socially distanced at the moment? We need to understand and accept that loneliness is isolating, can be devastating and even dangerous. And we all need someone. And when we're working with families, we need to unpack that with them to say, we'll work and speak to everybody and anyone that you wish for us to, because it's them we're trying to put back on track. It's them that the support and our offer is for if we work in children and family service. Thank you, James. So Liz Wendell is a co-author within the model, and she says, we know healing happens in relationships. We must create space for relationships to grow and thrive, not just for children. This is a whole family approach for the parents and grandparents. So for me, it's about seeing those before us and valuing the offer that they can offer to help. Thank you, James. So family finding, hopefully you're understanding where I'm getting to now. It's all about seeing the family before us, admiring their expertise, believing in them, and they can make an difference and we can enable them to do so. It's understanding safety is required, and also it's understanding belonging within families, and that families have multiple truths and many single stories that they will give us and we will offer about them, and that the family has a narrative and they all have roles, and we need to fill rooms with naturally connected people, being curious and hopeful and asking our best and even better questions to provide them with the best opportunity to change if they need to change, heal if they need to heal, or become stronger or get back on track if that's what they require, or have their children back if their children have had to come into our looked after environment because of risk. So family finding in our practice is about the heart, body, soul and mind. Like I've said, it's about you, it's about me, it's about children, it's about parents, it's about carers. It's recognizing how we can make a difference, and it's about understanding the importance of feeling loved and belonging. Understanding is only temporary without healing, and if we walk over healing, we'll only put a plaster over a gaping wound. We need to always remember that we need to help people heal and be the strongest and the best they can if they're going to have a life worth living, if they're going to have a change that is long term. It's about hope, it's about aspirations, and it's about understanding how this piece of work does fit with the longevity of life. And again, I've got an article later on that will point some of you to who may wish to read further. So when we're talking about limiting success and outcomes for those we serve, the children, young people, families, connections out there, we often limit them unwittingly by having single stories and not holding multiple truths. And some of the things that we often think about or have had told to us at different parts of the organisation and across the services, multi-agencies, the child's got no one. The mother's dangerous, maybe. A whole family they're all addicts. The father is buried his bridges, or hashtag, they don't have a father. Well, last time I understood biology, everybody has a father, and we need to recognise that. So then if we think about the lens of asking more curious questions, thickening that story, those single stories, those strip lines that we've all heard too often, more than likely, what are the capabilities and the gifts that bring people to family? What are the truths, and can we hold multiple truths? Can we build trusted relationships? Can we offer hope? Can we admire the future potential before people and understand the importance of everyone's role? So that's when we talk about intentional strength interviewing techniques. Even in the most worrying of situations, we need to explore who's taught the families and the people before us about justice, love, culture, dignity, family, safety, kindness. Because unless we understand who they are, their moral compass, and where they want to get to, we're never going to truly help them get where they want to be. And that's where we get the professional words like comply, disguise, and where we get plans that work, but we get the boomerang families that come back in to our service because we really haven't seen them for what they are, embraced that, and gone with what their multiple truths are. Thank you, James. So hopefully we understand that all parents, relatives, family, and naturally occurring community members are the agents for change in children's lives. The government and their contractors, of which we are, and the volunteers that exist are there to support but not replace families. Clearly there are the very small amount of children who are permanently removed and are adopted, and I'm clearly not thinking about those aspects of our service. But even then, we have open adoptions these days, and identity and belonging is so much more necessary to understand with children who wish to understand about their family of origin. Thank you, James. So the goals of family finding, tiny bit of our practice model, is to prevent us unnecessary family separation, to develop meaningful and enduring connections with the adults who will love children across their lifespan, to ensure stable, safe and healing connections for all children, for those who may need to be in local authority care due to protection issues, to ensure a timely and permanent exit if at all possible. Developing resilience and comprehensive networks of adults to support, that's our role, all of our role. Support all children in developing a healthy sense of identity, and to provide opportunities for them and theirs to help them meet that, and enable young adults who are emerging from care to live safely and productively in their communities and find their networks in their communities, if it's a church, if it's a club, if it's a pub, if it's a university, and to give them the people who need to wrap around them to grow into the most purposeful best adults that they wish to be. Thank you, James. So underneath pinning this is some science. So neuroscience, epigenetics, ACEs, which is adverse childhood experiences, and resilient community theory all build on this model. I'm not going to read the slide in detail for you. I know you're going to get the slides and you'll be able to read it, but there is science and longevity of life that unpicks healing the whole heart, body, soul and mind, along with safety. Thank you, James. So in a nutshell, 3 principles. It's about understanding what is predictable, can be preventable. The brain and body want to heal. Exercise, moving around usually makes people feel better at some point in their day, and that our biography is our biology. The 3 lessons are catalyst, convener and facilitator. That's all of us. And that we all learn best in groups, and that young people and families are our greatest teachers. Thank you, James. The truths: human connection is required to heal, restore and build health and development. Safety is only temporary without healing. Investigations that tell only the story of harm and its consequences result in dismembering practice, and it reduces the opportunity for recovering. Clearly it's necessary, but we can't do that without looking at what the strengths and what the good stuff is as well in all investigations that we have to conduct. What's most exciting about working with all individuals and families is the ability to heal and thrive. in the context of the relationships that they may already have. And it's about us being the catalysts of change to help them find those relationships, see what's before them. Values. Learn to see the human capabilities within people, their family, community and culture. It's about supporting young people and creating livable lives, self-determination and dignity. But simply, family finding is about seeing people and their capabilities rather than the problems alone, and standing in the best place we can to help. Thank you, James. So the components, urgency, we need to mean business here. We need to find family and we need to get them around the table. In my mind, every visit should follow with, okay, so if I'm visiting for the first time today, how many people in your community, your network or your neighbours would you like to be there as well? Let's get them all together and have a chat. Safety in its whole cannot be achieved without connections and belongings. And family finding is about asking practitioners wherever we stand with urgency to pursue healing relationships for children, assertively engaging families, holding on to safety and strongly challenging the structural barriers that may be in our organisations or within families to develop and strengthen those relationships, get them back on track if at all possible. So permanence is a state of permanent belonging in family finding, and belonging includes the knowledge of personal history, identity and culture. Thank you. Effective research. So family finding employs a variety of effective and immediate techniques to identify relatives and meaning connections. And it's about getting everybody in the room and understanding that someone will be able to help somehow. Thank you, James. It's as it says on the tin, it's a family-driven process. It's about looking at the assets before us and seeing how we can utilise them in a safe, manageable way. Thank you. It's about developing multiple plans, having multiple truths and developing multiple plans. Plans are effective if they're owned by family with agency support, and they're realistic, sustainable, safe, and facilitate healing. Thanks. So family finding includes professionals aligned to be catalysts, conveners and facilitators, and network and family members, young people and other supportive adults are the drivers of planning, decision making and solution building. So not going to go through this, but these are some of the tools if you work alongside with us, next to us, or are going to in the future, some of the tools you might hear us talking about with families. And that's just a list of them to give you a brief overview of what some of them may be. Thank you, James. And the last thing I think on my slides is to point you to the direction of this longitudinal study that was commissioned by the University of London in its association of childhood out of care status and all causes of mortality, and how children who live outside of their naturally connected families have a potential shorter life expectancy, and not necessarily because of addictions or mental health or violence or criminality, which are the single stories we would put to that study, but about healing and belonging as well, and about trauma-informed practice. So that's a brilliant read, well worth reading, and there's the hyperlink for that. I think that's me, is it, James?
It is, thanks,
It
Jo.
is. So I'm sorry if I've gone over.
No, we've got 5 minutes spare, so I suppose really open up for any particular questions. If anyone's got any questions, if you'd like to just pop them into the chat. I suppose I'll maybe just start off with a question for you, Jo, in terms of we've got a lot of people on the call today from sort of partner organisations that aren't sort of North Yorkshire sort of early help or children's social care. And I just wondered what you see their role in the family finding process, and how people who aren't social care or early help can help you support the families.
For me, wherever we are working, if we're working with children, young people, or parents or carers, see what's before you, ask those questions, be kind. Um, Always be safe. We know that that's a given. I don't need to say that. And ask about them and theirs, and who else could be at the meeting if you held a meeting at a different time, and who has helped them in the past, who's helping them currently, and who can help them in the future. Sometimes we bypass what's before us and jump to a service when not all the time a service is required. If we actually see how families have functioned and got to where they've been with a whole heap of success, even though they might be before you because of some trauma or crisis that's going on. So just taking for maybe the tree of life, the opportunity to really ask some questions about what goes on for them and who are the people that can support the families before us. In relation to working with us, we would hope that you would join forces and become part of the paid network if you're paid or if you're a volunteer, to help work in this way, to really focus back with families about they've got the answers. We just need to have the best toolkit we've got, which is our questions, once safety is gathered, to help heal people. So it's based on science, and it's about human kindness, and I think that's something in our profession we've all got.
And I think you touched on sort of the work with fathers or significant other sort of individuals, parents, carers who are around that family at the time. And I think that's something that's come to light within some of the reviews we've undertaken during the pandemic, where there's been potential sort of lack of opportunities as a dad or a birthing partner to go with mum to her appointments, where there's been restrictions just for one individual to be present at a scan or an appointment. And I think it's just being mindful, isn't it, of like you say, is who is around that family, who can offer some support, especially when we've been in the pandemic and being, I suppose, imagining quite isolating for some families who are who've experienced a newborn baby or even just life in general. But just looking at who's there to engage and support.
And that's a lifelong memory, isn't it? And which may need kindness, support, and a listening ear to hear on a worst day, and on a best day, it's something that is just had to happen, and people accept that, and a whole heap of difference in between. So for me, we although the children in children and family service are is why our files are open, that they are who we're serving. It's moving past that to the bigger picture of the whole family. And then it's moving past the whole family and understanding who we've got and what their roles and what their opportunities are to help or to hinder, because we need to understand that safety is incredibly important and paramount. We get that completely, but don't jump over people without asking the questions, and don't ever think that the people before you are all the people in that person's life, because they're not. And the more support in the community, the network, and the family that we have at the point that we need to become involved, the better we are to find change that is lifelong or long term, and that can carry on without us. So, from my point of view, if you are making referrals into us, then, the more detail you can put around a family tree or a tree of life, the better.
And just coming on to that referral, and a comment that Karen's just made in the chat, in terms of making sure that if you feel the need to make that referral for that intervention, is about putting as much information that you've got available that is relevant, and who is around that family to provide the support, and being really clear when you're putting a referral in, is thinking, actually, what do I want What do I want to happen? What does this family need, or what do they want to happen as a result of it? And making sure that detail is in the referral from the outset, really, and working with the family to tell them that the referral is going in, what would be expected to come out of it at the end.
And for me, you know, anybody who knows me knows my mantra if it's not good enough for me, it's not good enough. So if you're offering a service, if you're making a referral, is it what you would want to represent your situation right now with the most important people around you, or is there more digging to go and get?
Yeah.
Are we being fair? Are we looking to criticise, or are we looking to support and build and create safety? And for me, you know, we've all lived in a very difficult world for the last 18 months, and it affects us all differently, and we need to be mindful of that. You know, some people manage some of the time. Some people manage most of the time, some of the time, and a very few never. And that everybody's got strengths. We just need to deliberately lean into those to find out if it's safe enough. And if it's not, or you need to make a referral for support, we've got everybody who is vital to make a difference on that referral. And we've asked the curious questions, and we've got the consent.
Fabulous. Thanks very much, Jo. So that kind of concludes our first part of the webinar. So we've touched on, just to kind of have a bit of a recap, the hidden harm work that we've been doing as a partnership, looking at where we can encourage others to be the eyes and ears in the community, some of the resources that we can practically take and help disseminate messages of how we can work with fathers or birth partners or significant others to make sure that they're not forgotten about and they're not engaged, and also looking at that kind of wider family finding or family seeing that Jo mentions, about actually having a look what's in front of us, not just seeing things on face value, but kind of asking those questions. And I think from myself undertaking the training, the biggest takeaway that I took from the family finding training is what is preventable. What is predictable is preventable, and I think that's a really important aspect, because I'm sure in all our careers we've sort of reflected on and said, actually, I can see this happening to a child later in life. Well, if we can think that, then let's do some work together to try and prevent that from occurring. I'd like to just welcome Lorna and Ashley, and I'll let them introduce themselves and tell you a little bit about what they're going to be talking to you for the next part of this webinar.
Thanks, James, and thanks for inviting me to speak. My name's Lorna Galdus. I'm Commissioning Manager at the North Yorkshire Clinical Commission Group, or CCG. I've been invited to talk today about our offer of social emotional mental health across North Yorkshire. So got a series of slides that's kind of a really brief overview without going into depth of each service. But I'm going to do that alongside my colleague Ashley from HGFT, who's going to talk a bit more in depth about the HGFT offer, because there's been some recent changes. So Ashley, do you want to introduce yourself?
Hi everybody, I'm Ashley Eyston. I'm the Service Manager in North Yorkshire for the 0 to 19 service with Harrogate and District Foundation Trust, and my lead is Emotional Health and Resilience.
Thanks. So if you're okay, I'll just go through the slides, and when we get to the Healthy Child programme, you can have a little bit, I'll hand over to you at that point. Thanks, James. So in terms of the offer for social and emotional mental health across North Yorkshire, we're really fortunate that it has been growing over the past few years, and we have some changes and some additions to our offer. Obviously, that will be slightly different from your locality if you're outside of North Yorkshire, but you probably will have some similar services. One of the challenges with that growth, though, is that it's become more confusing and more complex. Obviously, it's a very large county. So I'm going to try and kind of briefly describe each offer and sort of where the thresholds are, but also just to let you know that we are working on a comms piece for this to make it easier for families, young people, education, etc. to understand, because we know that even though we've tried to do this, it still feels confusing. Thanks. On to the next slide. So just in terms of to put this into context, I'm sure that most of you here will be familiar with the I-Thrive framework, and if you're not, there's a link there to learn a little bit more about it. But in terms of when we're discussing our social emotional mental health, we use this framework and we're trying to embed that across North Yorkshire. So in the centre is thriving, and around the there are 4 quadrants around the edge, so getting advice, getting help, getting more help, and getting risk support. So we do try and put, when we're talking about the services, them within this Thrive framework. Thanks. So I'm just going to start with one of our most recent additions to our service offer. It's the Go-To. It's a website that's been designed for North Yorkshire, and it's a signposting website. So it provides information for young people, parents, carers, professionals, and also signposts to local services. So the idea of that is, if we're working with young people and families, this might be one of the very first interventions or places that you go to find more advice and support. Thank you. Compass Buzz is our school wellbeing service. It's been around since 2017. They have a number of different offers within that service in North Yorkshire. So they have a tiered training offer, providing emotional health and wellbeing training for schools. They also have a telephone consultation where schools can call up and speak to a wellbeing worker about how they might best support a young person within school. And then they have a text messaging service called Buzz Us for 11 to 18-year-olds, where young people can text that number and get advice back within from a wellbeing worker. Thanks. Another part of the service is Compass Reach, and that is more about supporting young people with mild to moderate needs. So that service is not school-based, so they can be delivered in the community, and that provides a slightly more higher level of intervention, so it's one-to-one delivery, and that is offered from 9 to 19-year-olds. So just in terms of changes to those services, just that you may be hearing, I don't know if you are aware that we are starting to change some of those services. So previously Compass Reach provided drug and alcohol misuse advice. That's now gone over to the charity Humankind. I've just put a link at the bottom there. And also from October, Compass Buzz and Compass Reach will be merging their offers, so it will be a more cohesive offer across North Yorkshire. Thanks. And then in terms of our specialist CAMS offer, across North Yorkshire, we have Tuve as our main provider. It's slightly different in Craven. I'm going to talk about that in a moment. But the CAMS service offer specialist support for those needing more moderate to severe support with emotional mental health issues. And then on to the next slide, thanks. And then as part of the offer, they have a single point of access. Professionals or families can refer directly into the CAMS service, and the details are there. They also have a specialist eating disorder for young people who've been diagnosed with an eating disorder, and also a crisis service for anybody who needs immediate attention within the community. And then again, one of the more recent offers is mental health support teams in schools. So you might have heard of this. It's a recent government initiative. So it's both Department for Education and NHS England looking at having mental health support teams within school. In North Yorkshire, we've had 2 pilots of this, so in secondary schools in Scarborough and also in Selby, and it's been delivered by Tuve. We've recently got some funding to expand that offer into Harrogate and Aurora District and Hambleton and Richmondshire. So across North Yorkshire, we will be looking to have those services embedded within schools. Just to note, they've been renamed by young people called Wellbeing Mind. You'll see the logo there, but the government calls them mental health support teams. Thanks. And just to make sure, in terms of North Yorkshire, we're clear that in Craven we still have the offer, which is obviously this is here is the mental health support team. So that's what we just talked about, embedded in schools. And onto the next page is the specialist CAMS. So it's just to note that the offer is really similar across North Yorkshire, but it's just a slightly different provider in the Craven part of North Yorkshire. Thanks, James. And that's just a little bit more information on that CAMS offer in Craven. So the next slide. And then I'm just going to hand over to Ashley, who's going to talk about the North Yorkshire 0 to 19 service.
Hello, everybody. Oh, it's a bit of an echo. Lovely, thank you. So in terms of our Healthy Child offer, we have a 0 to 19 service that spans across North Yorkshire, and the 0 to 5 service is health visiting, but from a 5 to 19 offer now, this is emotional health and resilience, predominantly aimed at 5 to 19-year-olds experiencing low-level emotional health needs. We do have a skill mix team across all of the areas in North Yorkshire, and one of the areas of development is that we're developing our team to include children's psychological wellbeing practitioners, trainee psychological wellbeing practitioners and emotional health and resilience nurses. Our offer of support can be face-to-face. We do also have a virtual platform, a drop-in, a go attend anywhere platform that I can circulate the information after this presentation. As I've just said, we are a home visiting service, and our kind of emotional health and resilience offer will be built on a family health needs assessment and a HEAT tool, which will be completed with every family at home. This is about just really making sure that we are clearly identifying need, and if we do need to, pull other services in, that we do have that facility to be able to do that. Again, about, it's a focus on family strengths, and it is a focus on improving outcomes for children. So as I say, this is not a fully kind of offer, but we do offer low level self-esteem, low mood, anxiety, behaviour and management linked to emotional health and resilience, low level risk taking behaviours, bullying relationship issues and building resilience. But if there is anything that any of the services or partners feel that we would be able to offer support with, we would encourage people to give us a ring as leads, to see what we can do in terms of support. As I've just said, the offer is completely across the whole of North Yorkshire, and we do have a virtual drop-in as part of our digital approach. We're in the process of developing Facebook pages and, kind of building on what we can do virtually for children, young people and families. And again, my contact detail is at the end of the service offer. If anybody would like any more information, you can either drop me an email, give me a ring, or if there is any referrals out there that anybody would like to discuss, please give me a ring. Thank you, Lorna.
Thanks, Ashley. I think there's just a couple more slides left. So just in terms of the locality centre hubs, so North Yorkshire County Council have locality centre hubs across North Yorkshire, and they provide support for social and emotional mental health. So there's a 6-week intervention they offer, and also 12-week intervention. And also there's details below that around children and family services, so the early help offer across North Yorkshire as well. And then I think there's one more slide. Yeah, and then finally, this is our digital offer across North Yorkshire called Couth. So it's an online platform. Obviously, you can access it 24/7 and obviously 365 days a year. In terms of their offer, they've got a number of different things. So they have some information, resources, they have chat rooms and forums, but you can also get support through counsellors. So there's online counselling available. So all young people need to do in North Yorkshire is just log on and you register, put your address in, and obviously if you're North Yorkshire resident, you can access it and you can receive all that information. So I think that is a very brief summary, hopefully, of all of the services that are commissioned. Obviously that doesn't cover private providers and the voluntary sector, but happy to answer any questions on those. And I see there's one in the chat box already. So would you like me to go to that one first, James?
Yeah, that would be great.
So Helen Smith, you've asked, would Compass Plus be available to earlier settings for pre-reception children affected by DA, please? What's DA?
I assume domestic abuse. Let me just see if I can unmute Helen and maybe she can provide a bit more. I think I've just, if you want to unmute Helen, you should be able to ask the question.
Yeah, thanks, James. Yeah, hi, morning. Sorry, hang on. Am I?
We can hear you.
Yeah.
Hi, morning. Thank you. Yeah, no, it was just you know how you were saying about notifying, schools and things like that. Is there anything, because we've been asked this by an earlier setting, I think they asked it in the Threshold webinar as well, James, didn't they? Whether or not, if there's a child and it's a pre-statutory school-age child, do the earlier setting get any notification?
I think you may be talking about the Operation Encompass, which is the domestic abuse notification that goes into schools, which is a separate, obviously, to the sort of the mental health support. Just on that question, I know we did ask the question around the early years, and the element of, I think, Operation Encompass is only available to to education, primary and secondary schools,
Okay.
as a part of a notification. That's due to the recording of students on a list of individual. So on the school systems that the local authority and police hold, we don't have all names of all children who access early years provision as we do with all secondary and primary school students.
Right, lovely. Okay, thank you ever so much. Sorry about that. Yeah, I've just got the compass.
Yeah, the compass. Yeah, no, that's fine. No problem.
All right, thank you.
Does if anyone else has got any questions for Lorna or for Ashley around any of the particular services? As Lorna said, these services are commission services, and there are a variety of other non-commission services through the voluntary sector organisations and support services around social, emotional, mental health that are available. As we will make sure that we've got information on our website around these aspects. In terms of sort of access to services, the GoTo website has all the information and is a sort of a website that we kind of continually support and promote, and making sure that it's quite as Lorna explained, there's so many different services, and dependent on the areas that you work, if you work over in our Craven patch, or if you work in Harrogate, and if there's like on the borders of the county, you may access services that aren't specifically a North Yorkshire service. So we are, as Lorna said, trying to work collectively to look at how we can improve the communication aspect, so parents and carers, children and people, and also professionals know how best or which service is available to individuals. Karen,
Jane, sorry to interrupt. Can you see that Karen's got a hand up?
Yeah, Karen, do you want to?
Yeah. It was just to add really a response to Helen's query in terms of the domestic abuse notifications. Helen, they do go through to the health visiting service in HGFT team, and we've been having some discussions recently about the responses to those domestic abuse notifications. So health visitors are aware. But in terms of support for early years workers who are aware that a child is living in an environment where there may be domestic abuse, this is something we can take back to the domestic abuse JCG for discussion, because there's obviously commissioning arrangements in terms of supporting children and young people who are living in households where they have experienced domestic abuse. So I'd be happy to take that back and have a discussion in that meeting about our responses to very young children, because I think previously we focused on older children in terms of their experience of domestic abuse. So I'll be happy to take that query back to see if we can look at any support for those very young children.
Thanks, Karen. Lorna and Ashley, I suppose a question that comes up in a number of sort of meetings and events is around the impact of COVID on mental health, and I know I touched on it in the earlier slides. Have you seen any particular? I'm assuming there's been an increase across all of the mental health provision and the services, and is there any? Has that provided any difficulties with services in terms of demand or waiting lists or those types of areas?
I mean, I can speak for our service. I think we did see a bit of a peak when children were preparing to go back into school. I think there was some anxiety, the children had been out for quite a period of time, and then it was back into school. I think we definitely saw a little bit of a surge related to anxiety. I suppose if you're talking about emotional health and resilience across the whole 0 to 19, you can look at the impact that's had on new mums who felt quite isolated, haven't been able to go to maybe groups or get out with their children who've been used to going to play groups, social activities, play and learn, all those types of activities. I think it's probably impacted on a lot of children across a lot of age ranges, but in different ways. And I think moving forward, we possibly will continue to see the fallout with that, James.
Yeah. Sorry, terrible echo. That's better. And just to echo that, in terms of the services that the CCG Commission, obviously specialist CAMS and Compass Buzz, we're continue to see that increase in demand growing, and also increase in acuity. So young people coming in more poorly than we might have in the past. So possibly that's been because of delay of seeking help earlier. And interestingly, we've also seen a particular increase in our eating disorder referrals, and that's a national picture as well. So we're seeing that nationally as well. So I think all of those services seeing increase in demand. One of the reasons why we want to put, for example, mental health support in schools and continue our investment into Compass as an early intervention is we know that having that in a way, those services in a way that young people can get to quicker. So, for example, if there's a service sat within your school or within a cluster of schools that you attend, we see that as being the benefit, as getting there earlier rather than later. But absolutely, we can't deny that there is much greater demand now on our specialist services. Yeah,
yeah, I think I was going to mention the eating disorders because I know noted on a lot of the regional and national calls the sort of increase in eating disorders that I've not seen within sort of the last sort of 5 or 6 years of working in this field. It seems to be increasing in terms of complexity, and as you say, I think that delay in presentation to support services probably due to the pandemic accessibility, or people feeling that they don't want to sort of overburden the NHS or just the lack of that face-to-face contact within health settings in the early days. I think that is this does seem to be that kind of higher complexity of cases coming to light. But I think if we can get in those early interventions and like you say, having teams within schools and within communities that people can access much earlier without the need to escalate into a complexity, then I think that's always going to be prevention is better than cure, isn't it, in terms of that. So thank you very much, ladies, for providing. I appreciate that was very much of a whistle-stop tour of Commission Mental Health Services. You will get all the information. I know it's sometimes quite difficult to kind of understand and comprehend just the information on the slides, but we will circulate those out so you can have that information available to you. And please feel free to contact us if you feel that you would like any of additional resources or support. So what I'd like to do next is pass over to Karen Hedgley, who is going to be talking to you about sudden unexpected death in infancy. Karen, I think we've got probably an extra we've got about half an hour if you needed that additional time, and we have got some time for some questions at the end if people want to. Feel free to put those into the chat and we can pick up any questions for any of the speakers at the end of the session. So I'll hand over to you, Karen.
Yeah, that's lovely. Thank you, and thanks for inviting me to come and do this presentation, James. So just a brief introduction for myself. I think I do know a number of people on the call, but for those of people who don't know me, I work as designated nurse for safeguarding children and children in care for the North Yorkshire and York CCG, so covering quite a wide patch. I have got a background in health visiting for about 13-14 years in central Middlesbrough, and I've been working in specialist safeguarding practice now for around 17 or 18 years. So that's my background. I've been asked to come along to talk about SUDI prevention, and I wish to stress that really. This is all about, as we go through the slides, you'll see the work that's been undertaken and that is underway across North Yorkshire and York, which aims to reduce the incidence of sudden unexpected deaths in infancy. And as you can see on the opening slide, it states the obvious, really, that obviously a sudden unexpected death in an infant is one of the most devastating tragedies that could happen to any family. And sadly, as a practitioner, I have had experience of working with families where there has been a sudden unexpected death. And as I reflect back on my years as a health visitor, there are certain vivid memories that you have, aren't there, in your career? I'm sure all of us have had that. And those days where I've gone into work and discovered that there's been such a tragedy in one of the families I've been working with is sadly the bad memories that I have in my career. Because the impact is huge, obviously, on the parents, but it also has a huge impact on any siblings, any extended family members, and very often within the extended community. What we also know, and certainly recently we've had some reviews in North Yorkshire and York, and this has brought it home to me even more, is the impacts on the professionals working with the families where there is a SUDI. That can't be underestimated. Certainly some of the poignant remarks that have been made by professionals in our recent cases, that they wish they'd known more about how to prevent SUDI, they wish they'd been able to support the families more in being able to reduce the risk. So it has a huge impact, but by and large, not completely, but by and large, SUDI is a preventable issue. And that's why I wanted to come along and talk to you about this today. Next slide, James. You will have heard a lot of terms being bandied around. I think sudden infant death syndrome, cot death, various other terms that have been used over the years to describe this issue, but we do prefer to use the term sudden unexpected death in infancy, because we feel that that actually covers the issues that we sadly are encountering. The important parts of this definition to pull out, and this is a definition from Professor Fleming, who was an eminent lead in the work around preventing SUDI, is that it's unexpected. Clearly, it's an unexpected death that could not have been anticipated in the 24 hours prior to the child's death, and that it happens in unexpected death that happens in children under the age of 1 year at the point of presentation. So those are the key aspects of what a sudden unexpected death in infancy is. Next slide, please, James. I think this slide is on this graph is very important for us to consider, because what we did see is a reduction. At the time we referred to it as sudden infant death syndrome. We saw a very dramatic fall in the incidence of sudden unexpected deaths in infancy during the late 1990s, late 1980s and early 1990s. And that was a period when I became a health visitor. And I remember very vividly the public health campaign, which was focused on safe sleeping positions for babies and not ensuring babies don't get overly warm. Some of you who are longer in the tooth, like myself, will remember people like Anne Diamond, who led a very successful campaign to try and reduce the incidence of SUDI. And it was very successful, but to a degree. Sadly, that dramatic fall hasn't continued, and what we are still seeing is around 300 infant deaths each year as a result of SUDI across England and Wales. So, if you think about that, that's almost one every day that we're seeing across England and Wales, which clearly is a huge concern for us. Next slide, please, James. Really helpfully, the National Safeguarding Children Practice Review Panel back in 2020. So for those of you not familiar with the panel has a role in looking at reviews that have been undertaken across the country. And one of the other key parts of their role as national experts is to undertake thematic reviews in the cases that they are seeing coming through. And they decided to undertake their second thematic review into sudden unexpected deaths in families where there were known risks of significant harm. Now, the first thing to stress here is that not all SUDIs take place in families where there are safeguarding concerns. Sorry, James, did you have a question? Oh, sorry. So not all SUDIs take place in families where there are safeguarding concerns, but what they very helpfully identified in the cases that they reviewed was that these deaths more often take place in families where there are risk factors which overlap with child abuse and neglect. So the known risk factors in terms of SUDI tend to be issues such as substance misuse, alcohol and illegal substance misuse, domestic abuse, mental health issues, unsafe sleeping practices. So you can see how the overlap with our more vulnerable families where we may have safeguarding concerns, you can see how that overlap actually happens. Next slide, please. Okay, so that's what's happening nationally. So the national panel have undertaken that thematic review. And at the very same time, our local North Yorkshire and York Child Death Overview Panel identified that over the preceding 2 to 3 years, they had seen an increase of SUDIs where unsafe sleep practice was seen to be a significant modifiable factor. So the decision of CDOP, the North Yorkshire and York CDOP, was they would do a deep dive into the SUDIs that had taken place over the previous 5 years. And what that identified were some very common factors, which were unsafe sleep practices in terms of co-sleeping, tobacco use, alcohol misuse at the time of the last sleep. And those were seen to be what's referred to in the CDOT world as modifiable factors. So very often there was multiple of these factors together in the SUDIs that had taken place across North Yorkshire and York. At the same time, so all of this was happening in 2020, which brought things to a head really for us as two partnerships. We were aware of North Yorkshire and City of York had commissioned 3 safeguarding reviews involving children known to have died as a result of SUDI. There were very common factors in all of these 3 cases, similar to what has been described already, is there were out of routine sleeping situations, sleeping with siblings, use of alcohol and illegal substances at the time of the last sleep. In a couple of the cases, there was a clear history of domestic abuse, quite chaotic households. So those 3 cases as well also were brought to our attention, and reviews have been commissioned in regard to those. But it became quite clear to both North Yorkshire and City of York partnership that we needed to look into this issue in more detail. Next step, please, James. Okay, so what happened was the CDOP initially set up a SUDI prevention task and finish group, and I took over chairing that group at the end of last year. And we were tasked with scoping out what is actually happening across North Yorkshire and York in terms of supporting families to reduce the risks of SUDI at the moment, and what do we need to do going forward. So the first task that we undertook was to do an audit with all of our health providers across North Yorkshire and York, to establish what information is being provided to parents and families during the antenatal and postnatal period. Are we happy with the information that's been provided? And actually that was quite reassuring. The outcome of that audit was reassuring. The messages around safe sleep were being delivered universally to all families antenatally, excuse me, and postnatally. Those messages were research-based, were based on the current information that we have, and different formats were being used in order to try and support families with different needs. However, what we did actually acknowledge was, given the findings from the thematic review, given the initial findings from the reviews that are underway and our audit, that actually we needed to start looking at SUDI prevention through a safeguarding lens via the safeguarding continuum. This is what was advocated by the national panel. They're suggesting that actually providing that universal offer to families clearly remains very important, but we need to be in a position where we can perhaps work with our more vulnerable families in a different way or in an enhanced way in order to reduce the risks. So we wrote a paper as a task and finish group to both North Yorkshire and City of York safeguarding partnerships. proposing that we as partnerships develop a prevent and protect model across North Yorkshire and York to ensure that all agencies, not just health practitioners, have the necessary skills and knowledge to work with families where there is increased risk. That paper was presented to both partnerships, and both partnerships thankfully welcomed it, welcomed the proposal and have endorsed the proposal, and I'll come on to talk about what that means very shortly. So what can you do as practitioners? Well, the first thing is that all practitioners working with families where there are infants, where there are very young children, or where we're working with families where there is an unborn child, can reinforce those safe sleeper messages with the new parents, but not just with new parents, with extended family members, grandparents, is trying to reinforce that message to support the messages that are already being delivered universally by health colleagues. There is a new resource. There are new resources on both City of York and North Yorkshire partnership websites. We can forward the links to that. I probably should have put the links in this. We'll add the links before we send out the presentation, which provide the level of information that you might need in order to reinforce those messages. The other thing that we can all do is identify families who are most vulnerable and explore risks and issues with the families. So there are families, as we've already explained, what the research is telling us, what the thematic review is telling us, is there are families where there are increased risks, and we can explore those issues in particular with those families. And if you do consider that there is a safeguarding concern when you are looking at those situations, is thinking about, is this a safeguarding concern? Do I need to seek some further advice? Do I need to seek further support from our colleagues in Children and Families Service? And as part of the Prevent and Protect model, is access to resources which will be developed over the next 6 to 12 months, which will support you in terms of supporting families to reduce the risk. So what does the Prevent and Protect model look like? So these are the 7 key areas. So what we now have, our first meeting is next week, 1st of July. We've got a multi-agency group meeting from across North Yorkshire and City of York. We have a draft work plan that we're going to work to, and it will be looking at these 7 key areas. We will be looking to further develop the multi-agency guidance on safe sleep, so it's accessible to practitioners working with families. Very important, we're also going to look at, and we're at the early stages of developing a SUDI assessment and risk minimisation tool for practitioners to use with families. It may come as a surprise to yourselves to know that there is no nationally recognised risk assessment tool for SUDI risk assessment. The national panel stopped short of producing a risk assessment tool that could be used nationally, but in many ways that's helpful because that means we can develop and tailor a tool that is applicable for our area. Really importantly, we're also going to be developing some training, some masterclasses to support practitioners to have those effective interventions around SUDI prevention. And safe sleep will become part of policies and procedures. We're going to be reviewing policies and procedures, but any future policies and procedures, we will make sure that is a thread that runs through. I think probably one of the most important aspects of our work plan is to develop processes whereby SUDI prevention becomes part of, where relevant, obviously with relevant families, any early help, child in need or child protection plan. Because one of the early pieces of learning that we've established via our reviews that are taking place or have taken place in North Yorkshire and York is that isn't something that has been reflected in the plans when families have been opened to Children and Family Service. That SUDI prevention aspect hasn't necessarily been there really within the plans. We obviously are looking towards raising community awareness about risks associated with SUDI as well, and we've got the comms teams on board. They're very keen to get involved, and hopefully we'll have some form of a campaign over the next 6 to 12 months to raise community awareness excuse me, around SUDI prevention. And obviously future commissioning arrangements, we need to consider the safe sleep aspects. It needs to be integral to any kind of commissioning strategy as we go forward. So there's quite a lot of work to do. There's a lot of work that's taken place already, but there's a lot of work to do to make this reality for our frontline practitioners. I welcome any questions and I welcome any comments. You can email me if you've got any suggestions in terms of anything that we might look at going forward. There are some references on the slide there, as you've seen. For some reason I've just lost my screen there. There are some references there that you can have a look at. The Lullaby Trust is an excellent website that's got some really good resources, but again, like I've stressed, the Safeguarding Partnership websites have also got very good resources as well. And if you wanted to have a look at that report, it's available to you as well to look at the thematic report from the national panel. Sometimes those reports are quite dry and not particularly accessible, but I have to say I found that report really quite easy to read and made complete sense to me. So if it's an area of interest for you, I would suggest you get a hold of that report.
Thanks very much.
Happy to take any questions.
If you do have any questions, please feel free to add those into the chat, and we'll, or if you want to raise your hand, I'll be happy to unmute your mic. I think it's really important subject, something that we've seen particularly over the last sort of 12 months, 15 months, that increase in sadly unexpected death in infancy. We've got a question here from Helen Karen. The DfE has added additional wording to the revised Early Years Foundation Strategy Framework from September to include the need for checking sleeping children in early years settings. So that's a really important aspect to cover. So thanks very much for that update, Helen.
I will be coming to Helen at some point in the future as we work through the work plan, because we want this to be messages that are shared really through every avenue that we possibly can share them. So similarly to when I came to you about the ICON messages, Helen, I'll be coming to you with the SUDI messages.
And I think just I suppose a point of learning that we've identified with some of the cases is that moment of change or spontaneity within the family setting. So be it staying over at someone's house, being under the influence of alcohol, multiple occupancy within a bedroom, all add additional risk factors to the likelihood of a sudden unexpected death. And I suppose it's following those sort of messages, isn't it, that making sure that their sleeping arrangements are suitable, making sure that they're clear of bumpers and toys and other aspects. So I have put on a link on the chat to the Safe Sleep for Babies page on our website, and as Karen and the group will develop the Prevent and Protect model, we will be adding additional resources and information. And as Karen already mentioned, the Lullaby Trust have a raft of information that we use locally but also nationally to try and get those messages out to families. So it doesn't look like we've got any additional questions. I don't know if you've got anything else to add finally, Karen.
Yeah, just to pick up on what you said there, really, James, to stress that out of routine. It's no mistake that actually the thematic review was named out of routine, because very often the chaotic is probably a strong word to use, but when you look at many of the reviews, that there has been a change of routine because of something that's happened within the family at the time of the baby's last sleep. So it could be that there's been an argument, a domestic abuse incident or something like that, which has led to an unsafe sleeping practice. And one of the things that we will be looking at in our risk assessment or risk minimisation tool is stressing the issue of sleeping with siblings as well as sleeping with adults or parents or carers, because actually some of our cases have actually involved sleeping with the siblings, and that's where the risk has actually come in. So I think that is a really important thing to think about.
Thank you. We've just got a comment there, just a thanks. Just saying that in East Riding we still refer to SIDS, but I like the idea of sudden unexpected death. Sounds softer in the title.
Yeah, I think one of the movements away from sudden infant death syndrome, when you talk about syndrome, people tend to think about it being some kind of an illness or a genetic issue, rather than, and actually that is not the case. So that is one of the reasons for moving away from the use of the term SIDS to sudden unexpected death in infancy.
Fab. Thank you very much. So as we haven't got any additional questions, we'll move on. But again, please, if you've got any conversation, it's always difficult doing these virtually and kind of gauging the audience. And if we were in person, it's a little bit easier to sort of share and have that conversation. But if you do have any questions, more than happy to take those and present them. So really, we kind of come into the end of our webinar, and I'm kind of pleased in a way that we have finished a little bit earlier, because it gives you an opportunity to probably have 20 minutes or so break before your probably next meeting that starts at 1 o'clock. So I will just take 5 minutes just to summarise and to promote some additional aspects. But just to say, from a partnership point of view, from North Yorkshire, information and communication is one of the key aspects of our partnership, and assuring ourselves that agencies are working effectively to safeguard children, young people and families. One of the ways we do this is about sharing information via our e-bulletin, which is a free monthly e-bulletin that you can register yourselves, team members, anyone who's interested, and you get the latest information from the partnership into your inbox on a monthly basis. We also embrace the use of social media, so you can find us on Facebook, Instagram, YouTube and Twitter. And again, it's just another mechanism that we can get information out, other than the sort of the general kind of email communication threads that we'll send out to service heads, and hopefully that makes its way down the chain to those people on the front line who can learn and understand and see what services are happening across North Yorkshire. Safeguarding Week, we focus primarily on 1 week in the year, but appreciate that every day safeguarding is everybody's business, and that we should all be working to safeguard not just children, but also the wider adult population. Hopefully you have found today's session useful. Please, we'd love to hear any comments. If you are on social media, please follow us or use the hashtag safeguarding is everyone's business, Safeguarding Week 2021, or tell us your concerns, and you'll be able to see the variety of activity that's happening, not just across North Yorkshire, East Riding and the City of York, but also with our colleagues across the country, particularly West Yorkshire have got Safeguarding Week on today, and I've seen it further afield in down south in London and other areas as well. So I think that really kind of leaves me just to say thank you very much to our speakers for their input today. We don't have any additional questions, so I'd like to grace you with an extra 20 minutes of free time. I will circulate out the slides and the recording probably next week, and I will circulate a feedback form after the webinar for you to provide us with any feedback from today's session. So thank you very much. I hope you have a lovely afternoon, and looking forward to the weekend ahead. Thank you.